10 tips for caring for the elderly during a pandemic. Elderly people face a higher risk of becoming infected during a pandemic because they tend to have weaker immune systems, making them more susceptible to illnesses and infections. Those with chronic illnesses are subjected to an even higher risk. For these reasons, it is crucial to be aware of the best ways of looking out for the elderly according to their additional needs. Using effective means of protecting yourself is extremely important during a pandemic, especially if you are included in this more vulnerable group. 1. Continue taking vitamin supplements. You should continue to take vitamin supplements to support a healthy immune system, which plays a crucial role in helping your body fight infections more effectively. If you are not taking any supplements, you can get in touch with your health advisor to find out if you should start, especially if you have any chronic illnesses. Some of the more common supplements recommended are vitamin B12, calcium, and vitamin D. It is also important to bear in mind that not all supplements aid in supporting a healthy immune system. 2. Continue taking your medications. It is important to continue taking your medication while quarantined. Therefore, make sure you have your regular medication readily available or well stocked. You can talk to a health professional about having access to 2 months of medicines during isolation. If you are living with other people, you can speak to them about your need to stock up on medical supplies as well. 3. Wash your hands thoroughly. Washing your hands thoroughly while you stay at home can never be overemphasized. Wash hands thoroughly with soap and warm water using the 20 seconds rule. Use hand sanitizers and avoid touching your face, nose, mouth, and eyes. Keep your home clean and frequently touched surfaces such as doorknobs, light switches, sink, and toilet handles clean and disinfected. 4. Maintain a healthy diet. Being in isolation does not mean you have to worry about not eating healthy. Making eating a healthy diet one of your priorities is advisable. Focus on foods that aid in boosting your body's immune system, which plays a crucial role in protecting you from infections and harmful viruses. Limit or avoid sugary foods, fatty foods, and alcohol. Focus on diets rich in lean meats as well as fruits and vegetables, etc. Increase your intake of food rich in antioxidants, which help protect your cells from damage, and probiotics. Be sure to remain properly hydrated as well. 5. Avoid sharing personal items. Avoid sharing personal or hygiene items such as utensils, water bottles, food, and bathing soap with others. This small action can play a significant role in protecting you and your loved ones from getting infected or spreading an infection. 6. Get enough sleep. Getting plenty of rest is an effective way of staying healthy and reducing your stress levels. Make sure you not only get enough sleep every night but that you also get enough rest throughout the day. One of the significant reasons you may be more vulnerable to illnesses during a pandemic is due to too much stress and not getting enough rest. So make sure you reduce your stress levels by getting enough sleep, proper rest, and remaining active. 7. Remain active. Staying healthy and remaining active does not necessarily require you to go out. You can continue improving your health even if you have to stay at home by being active every day. Moving around and being active plays a significant role in helping your body fight off infections and inflammation. You can stay active by doing non-strenuous exercises such as doing household chores. You can also try meditation as well as stretching exercises if this is possible. However, you should avoid exercising for more than an hour a day to prevent fatigue. 8. Keep in touch with your caregiver. A lot of older people have caregivers, and some are caregivers themselves. If you have a caregiver and he or she cannot risk coming into your house, you can keep in touch via calls or messaging. Talk to your caregiver about who can provide you with care if he or she falls ill. If you are a caregiver, you need to make sure that you and the person you are caring for take the necessary precautions to avoid getting infected. 9. Stay at home. Understand that the advice to stay at home during a pandemic is good advice that is for your benefit. If you are not infected, stay at home as you are more vulnerable to getting infected. If you are concerned about groceries, you can do online shopping or ask a family member to do your grocery shopping for you. 10. Avoid large groups. If you are living in a residential care home, make sure you avoid large groups. If you have a large family, remember to keep a safe distance from others, avoid shaking hands, and making any other close physical contact. It is important that you contact a health professional if you have a persistent dry cough and a high fever. By being consistent in taking these basic precautions, you will significantly lower your risk of infection. Stay positive and stay healthy.